Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The maxillary and mandibular master cast have been mounted on the articulator, the centric relation check bite verified, and the condylar mechanism of the articulator set from the appropriate protrusive check bite, in this instance 20-degree mechanical equivalent. We have arranged the maxillary and the mandibular anterior teeth aesthetically and have set the incisal guidance based on the horizontal and vertical overlap of these anterior teeth. That setting was accomplished by loosening the condylar mechanism and then protruding until an end-to-end relationship was established between the anterior teeth, and then loosening the guide table and rotating it up until the pin touched the table lightly. After verifying these articulator settings and studying very carefully the patient variables, we have selected for use with this patient a combination of molds. The combination of molds that we have decided to use are, for the maxillary posterior teeth, this 20-degree tooth, in which we have a semi-anatomic tooth with some relative cusp height. This particular tooth we will then articulate with this tooth, which is the 0-degree mandibular posterior tooth. For our patient, we will be using only 3 of these teeth: the second bicuspid, the first molar, and the second molar. And that is because of the space that we have here available to us in the posterior part of the mouth. You will notice that the space from the distal of this cuspid to the area in which the ridge begins to incline towards the retromolar pad, that this is a relatively short distance, and that for our patient a bicuspid and 2 molars will fit into this area quite nicely. Before we begin to set the mandibular posterior teeth, we must modify the 0-degree mandibular posteriors, and that modification requires that we very carefully take a suitable burr, and what we want to do is to eliminate these little marginal ridges that appear on the first and the second molar to permit the lingual cusp of the posterior tooth to interdigitate into that central fossa. Now we have several burrs available to us to increase this occlusal opening. And I'm just going to show you 3 here that I find most useful for this particular technique. We have first the number 8 round burr. The second is a 7B diamond, and the third is the round gemstone. Now the gemstone and the number 8 round burr are very appropriate for the acrylic resin teeth. This round 7B diamond works quite well when you are using a porcelain posterior tooth. This tooth being acrylic resin, we will use the number 8 round burr. We'll very carefully take and with the burr remove these grooves down into the central sulcus here, the entire mesial distal length of the tooth, particularly over here into the lingual area. On both sides, we again will open up the central sulcus of the tooth. This area should be well open in order to receive the lingual cusp of the maxillary posterior tooth. Now you can see we have that space wide open in order to receive the lingual cusp. We'll now go ahead and we will grind the second molar. Again, using the same approach, removing these grooves and ridges and increasing the size of the groove onto the lingual surface in the distal area here. In other words, opening up the central fossa, if you will, of this tooth. The same grinding sequence is followed for the second bicuspid. The first bicuspid we will not be using. This is a little smaller tooth and of course a little less grinding, but again we must open up this central area. That gives you some idea of the amount of tooth structure that should be removed. After removing the tooth structure, we can now take and check it here on the articulator in its position. And my first impression is that the tooth is a little bit too long in order to fit into this area and will require some grinding. And the best instrumentation for that grinding is to use a handpiece mounted heatless stone and very, very carefully grind on the undersurface of this tooth, maintaining the curvature to the tooth. In other words, let's not reduce the length of the tooth at the cervical margin. Let's just ridge lap the tooth, permitting it to be positioned over the base plate. We've removed enough of the tooth now and can take a small portion of pink base plate wax and roll it into a small cone and then attach this cone to the undersurface of this tooth, which now then gives us a very, very tiny cone of wax to use in seating the tooth. Then pass it again through the flame just to soften the wax lightly, and very carefully then place it in position on the base plate. Now you'll recall that one of the objectives in setting the bicuspid was to line it up along the long axis so that it is perpendicular to this plane of occlusion, and also that it is at a height at the buccal cusp and cuspid when projected back to 1 to 2 millimeters below the top of the retromolar pad, that the bicuspid is at the appropriate height. We can remove this excess wax here for better visualization of the tooth, and you will notice that it's just a little bit too low, so I'm going to very carefully tease the tooth up. There we are. Now if we look at the tooth in the from the buccal, you will notice that the long axis of the tooth is perpendicular to the plane of occlusion, and that the buccal cusp is flat in line with the cuspid and the area here at the retromolar pad. At this point, we can seal the tooth into position with the hot end of the number 7 spatula, and once that has been accomplished, we can proceed to setting now the first and second molar. Again, we will take a small segment of wax, place it on the first molar, and position that tooth next to the bicuspid. You will notice that the tooth has been positioned over the crest of the ridge from the cuspid back to the retromolar pad area. If we view this tooth again from the buccal, you will notice that the mesial of the tooth has been positioned level to the distal of the bicuspid, just a little bit low, so I'm going to raise that up slightly. And then I'm going to elevate the distal of this first molar in order to create a slight anterior-posterior compensating curve. Again, the tooth can be manipulated slightly and sealed to the base plate with the number 7 spatula. If we view the tooth now from the frontal view, you will notice that the tooth is positioned so that the buccal cusp is slightly elevated and the lingual cusp is slightly depressed to give us the buccal lingual compensating curve. Again, we will heat a small segment of the pink base plate wax in order to unite the second molar to the base plate. Our objectives in setting this tooth are again to have the mesial portion of the tooth at the same level as the distal of the first molar, seal the tooth to the base plate, and then examine again the medial lateral and the anterior posterior curves and the relationship of the tooth to the crest of the ridge. As we view it in this direction, you will notice that it is a little bit too prominent on the lingual, so I'm going to depress the lingual slightly. There we have the tooth in the right relationship. Now I shall look at it from this particular view, and you will notice here that we have a little bit too much compensating curve, so I'm going to depress the tooth slightly. There we are. And looking at it from the occlusal view, you will notice that the tooth in this direction does follow down the crest of the ridge from the cuspid to the retromolar pad. At this point, we can go ahead and seal these teeth to the base plate in preparation for setting the maxillary first molar. Again, we will join some wax to the undersurface of the first maxillary molar, soften the wax in the flame, and position that wax and tooth in the proper relationship to the maxillary base plate. We can seal this with the hot end of the number 7 spatula and then close the articulator into the occlusal relationship and see if the tooth matches its antagonist. We can close the articulator. A little bit too far to the distal here, so we'll very carefully work the tooth anteriorly until the tooth interdigitates with the molar. I'm going to open this again slightly and just tip the tooth out, permitting the maxillary lingual cusp to fall into that enlarged central sulcus. You can see here we have the appropriate interdigitation, and we can go ahead and seal this tooth to the base plate. Once we have sealed the tooth, the one remaining area to check is to loosen the articulator and to move the articulator into a protrusive movement to be assured that the compensating curve is adequate to permit the maxillary lingual cusp to strike the mandibular posterior teeth. I've loosened this, and now I'm going to protrude the articulator slightly, and what we are trying to visualize is this relationship of the lingual cusp. And you will notice that the maxillary lingual cusp is, down in this area here, is away from the tooth. So I'm going to depress the neck of this tooth slightly there. You notice the lingual cusp is seated itself, now coming back into centric occlusion to again check the buccal relationship. We now can go ahead and proceed and set the first bicuspid and the second molar. We can now add a small portion of wax to the bicuspid and position it in relationship to the maxillary molar. Again, teasing it in between the molar and the cuspid. And at this point, seal the wax before closing the articulator using the hot end of the number 7 spatula. And then we can close the articulator to check for interdigitation. Close this against the mandibular antagonist. You will notice that we have fairly reasonable interdigitation. However, the neck of the tooth is coming out slightly. So I'm going to depress the neck of that tooth. Again, the importance of the lingual cusp seating into the interproximal is of utmost importance. If you look at the tooth in this direction, you will notice that the bicuspid is a little bit too prominent. And usually the reason for that, it's the lack of interdigitation of the lingual cusp into the lower central fossa. So I'm going to open the articulator, and taking a small piece of red articulating paper and placing that over the region of the bicuspid, and now I'm going to close the articulator and very carefully tap the articulator to check and to see just where the contact is located. You'll notice that the marking is on the distal marginal ridge, and if we very carefully remove this with the number 8 round burr, it'll permit a little better interdigitation of the maxillary tooth. We can remove our grindings here, and now very carefully we will move the bicuspid a little bit to the lingual and the maxillary arch here, and then close again to check the interdigitation. Soften the wax, slightly move the tooth, and close the articulator and seal the wax. You will see now the buccal aspect of the tooth is not nearly as prominent as it was previously. Again, we'll just depress the neck slightly and seal the tooth in position. Now as we turn this, you can see that the tooth is not quite as prominent as it was before. Now we can proceed and set the second molar. Again, taking a small portion of pink base plate wax and positioning the second molar and then closing it against its antagonist to check for the interdigitation. Lining the tooth up and sealing it to the base plate. Sealing the wax and closing the articulator into interdigitation. Again, you will notice that the the molar is not quite seating properly, so we will again position the lingual cusp, verify its relationship, check it very carefully, and if interferences still persist, again we will use the articulating paper. And I think we can improve that by looking for the interference with the articulating paper and modifying the tooth. So we'll open this, place the paper, close the articulator and tap, and look for our interference. Again, we can remove this small area with the number 8 round burr, remove the debris, and then again reposition the maxillary second molar. We will close the articulator, and we can now go ahead and seat the molar into the central fossa. See how the tooth then slipped down into the central fossa, improving that relationship. At this point, we would go ahead and seal the wax and check very carefully to make sure that the interdigitation is what we want, re-verify our protrusive contact, and then we can go ahead and proceed to set the teeth on the opposite side in preparation for preparing the art portion and sending the denture to the dental laboratory. We have completed the setting of the posterior teeth and performed a preliminary wax-up prior to going to the patient. At this point, the teeth are interdigitated properly, and it would be worthwhile, I think, to review some of the objectives we have set up for this particular combination of posterior teeth. So if we'll turn to these other models for a moment. The first step was to grind out the ridges on the mandibular posterior molar in order to increase the size of the central fossa here. We remove these ridges all along the entire mesial-distal and buccal-lingual width of this tooth. In so doing, that would then permit the maxillary molar to interdigitate into the central fossa and create our so-called lingualized occlusion. You also will recall that we were quite concerned about the anterior, posterior, and medial-lateral tilt to the tooth, the establishing of the compensating curves. And again, this was required in order to properly interdigitate this lingual cusp and permit the lingual cusp to pass towards the lingual surface of the lower molar, towards the buccal surface, and towards the distal lingual surface in the various excursions. Now if we turn to the articulator, we can evaluate the setting of these teeth to see if our objectives have been met. You will notice that the lingual cusp are into the central fossa of the mandibular teeth, and if we loosen the condylar mechanism and move the articulator into a working relationship, you will notice that the lingual cusp begins to move through the groove. There are some prematurities. However, these can be eliminated after processing and make this a smooth, working, lingualized occlusion. If we move now in the balancing movement, in this manner here, you will notice that the lingual cusp now moves towards the buccal, and we are very, very close to contact, particularly up in the bicuspid region and in the molar regions, both first and second molar. So this is within the range of equilibration. In the protrusive movement, also, you will notice that the lingual cusp comes up the distal lingual surface on the molars. The bicuspid is a little bit light, and one might want to even do a little occlusal equilibration or perhaps even altering the compensating curve slightly to compensate for that. But all in all, the interdigitation in the various excursions and the tooth contacts are certainly within the range of correction following processing and equilibration. Now if we look at the buccal surface of the teeth, we can see what is happening to the aesthetic arrangement of the maxillary buccal cusp. Aesthetically, we have a nice arrangement here with the buccal cusps, and the class 1 molar relationship of the maxillary to the mandibular tooth has been maintained. As we move through the lingual cusp here in the working excursion, you will notice that we come through quite smoothly. While in the balancing excursion, the lingual cusp moves up, and we have some lingualized contact here, or close to contact, which is required in our eventual equilibration. In the protrusive movement, again, the existence of tooth structure is available for eventual equilibration. At this point, we are now prepared to go to the patient and to secure our full trial denture try-in.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.